Healthcare Terminology: An Examination of Functionality in a Health-Related Organization by Shikarra J. Mosby. Healthcare and its complex nature. What occupations make up a healthcare facility? Medical assistants, nursing assistants, home health aide, licensed practical nurses, physicians, therapists, registered nurses, and pharmacy technicians, and so much more. This list does not even touch on the administration and management aspect of a healthcare facility. The dynamic nature of health-related organizations are very complicated and take the cooperation of many independent professions working together in order to operate seamlessly. A breakdown of a primary care team structure. Some of the questions revolving primary care team and their dynamic is: what makes up an individual primary care team? Primary care team, or PCT, is typically a team of health professionals that work together in meeting the needs of a person. PCTs provide a wide range of services, including general practitioner services, practice nurse services, and occupational therapy services. And that's just to name a few. There are other services in addition to the services previously listed. There are also services in addition to the additional services that have not been listed that may also be available and placed to support the PCTs. Things such as psychology and counseling are examples of these supporting services. Communication in a health-related organization. In primary care alone, there are so many people that touch a single patient's medical record. Physicians may ask the opinions of their colleagues. Nurses may add vitals for the physician to view. Then you have pharmacy technicians that also view to some effect your record in order to fulfill a prescription ordered. Then medical billers and coders to some effect may view your record in order to properly bill for procedures and services received, not to mention the healthcare administrators who also to some degree come in contact with patient files. So it's a lot of people dealing with sensitive and private information, and effective communication is required in a medical setting in order to ensure that no mistakes are made in between the persons dealing with a patient's medical record. In doing so, each healthcare worker holds a unique responsibility in ensuring that correct information is being communicated back and forth between each other. Medical terminology can be defined as the language used in order to precisely describe the human body. This includes the components, the processes, and conditions in which may affect it, and this also includes the procedures which are performed in direct relation to it. Why? Why is it the responsibility of healthcare workers to ensue and practice exceptional communication skills, and what are the needed qualities promising the required skill a medical-related profession is expected to maintain? When left with the task of determining the proper care for the public, there then comes an expectation and standard in which this care is to be presented. Proper knowledge and skills are expected of workers when dealing with sensitive and vulnerable patient information. Medical terminology is a knowledge that is expected of healthcare workers, no matter how seemingly insignificant the job duties may present itself. Medical workers must work together in tackling the common goal of caring for the community. Each function holds unique significance in completing this task. Organizational responsibility and its relevancy to a healthcare organization. What describes organizational responsibility of a healthcare facility? To answer in short, providing effective and exceptional service of high quality. Medical mistakes. What defines or describes a medical mistake? In other terms, a medical error can be described as a preventable adverse effect of care. Some examples of medical errors include medication errors, anesthesia-related errors, inadequate follow-ups, and failure to take proper precaution and technical medical errors. Addressing medical miscommunication. It is very important to note that medical miscommunication plays a big role in medical errors. Many medical errors are preventable with proper communication practices. There is a study of medical errors and relevancy to United States hospitals. Here, it has been determined that medical errors has had more than its share of preventable deaths that occur in the United States. It has also been determined that in this study that nearly 80% of all serious medical errors are direct results of miscommunication. It is very important to identify that there is a real issue that drastically can be addressed and corrected with much needed efforts. There is more to it than just identifying. It also takes recognition on the role we play as healthcare workers and the continued efforts that are needed on our behalf to help tackle this issue. Adequate knowledge of medical terminology can help in addressing medical miscommunications. Being able to catch mistakes that may slip through the cracks of multiple persons who deal with patient medical records is the combined responsibility of those who have access to such files. So, in addressing medical miscommunications, identifying the issue is a part of it. Recognizing the role that individual medical or healthcare workers play is a part of it, and then also practicing exceptional communication skills is also a part of addressing medical miscommunications. In the concluding notes, I really want to touch on the responsibility of a healthcare organization and its reflection of providing a care service to the public. Philippians 2:4, let each of you look not only to his own interest, but also to the interest of others. 1 John 13:34-35, a new commandment I give to you, that you love one another just as I have loved you. You also are to love one another. By this, all people will know that you are my disciples, if you have love for one another. Again, I would like to close with the previous verses to emphasize that caring for the public is a huge responsibility. It is more than an occupation and so much more than a paycheck. This work requires patience, compassion, and understanding. Those who choose to take on the responsibility of dealing with vulnerable and needing, those who choose to do such meaningful work choose to do so for a reason, and it is so important that they do not get caught up in the secular aspect of their calling and look back to the significance and impact their work has on the people and the community.